I'm going to be performing the newborn assessment. We do this to ensure that the baby's life outside of mom is progressing without problems. And we use the data gathered during the initial assessment as the baseline. When I come into the room, I'm going to perform hand hygiene and do IPI. I'm going to check the baby's ID band with mom's ID band, and I see that the baby's on a blanket and not on a cold surface. I've noticed that mom and baby are bonding and mom is breastfeeding successfully. This means baby has normal sucking and swallowing reflexes, and I observe both of those and I could double check those as well. Baby is mom's firstborn and mom and dad are happy with their baby girl. The vital signs were documented in the worksheet, and the newborn is alert and not persistently lethargic. And I'm gonna have gloves on as I start the assessment. I'm gonna use a scale to weigh the baby. She is 7.2 pounds. And I'm also gonna measure the length of the baby, and she's 19 inches. These are both indicators for gestational age, and after this I know the baby's AGA. And as I move to the head, there's no kaput or cephalohematoma. The head is slightly elongated, which will typically resolve itself within a week. There are no abnormalities to the fontanelles or the head size. Baby has dark, even hair throughout her head. The ears are symmetric and aligned with the outer canthus of the eyes. The pinnas are well formed, soft and pliable, and there's good recoil when they're folded and released. And the face is full and symmetric, and there is no milia. The eyes are clear and symmetric and less than 3 centimeters apart. There is no edema in the eyelids, and the sclera is white. The pupils are equal and round, and now I could check the reactivity to light, and I would turn the lights down and use my pen light, and I would see that they are reactive bilaterally. The nose is midline, small and narrow, and I could check the nares, and they're equal in size and patent. The mouth is symmetric and positioned midline. There are no lesions. The lips are pink and moist with no cracking. And as I put my finger in her little mouth, the lips encircle my finger to form a vacuum. And then I can see the soft and hard palate are intact. The tongue is free moving, midline and not protruding. Mucous membranes are pink and moist. And now I can check for the root reflex. And I could just stroke the side of her cheek, and she moves her head in the side I'm choking, so that's normal. And the neck is free moving and midline. And I can see baby can hold it briefly without support, and this is another indicator for gestational age. And there's no webbing in the neck, and the clavicles are intact and straight. The chest is round and symmetric. The nipples are slightly engorged, which will usually dissipate within a few weeks. Now I'm going to clean my stethoscope and listen to baby's breath sounds. So I'll listen in 6 locations. And after I listen to the 6 locations, I see that they're equal. There's little difference between inspiration and expiration, and they're unlabored. And then I'll also listen to the apical rate, and I'll listen to this at the 4th intercostal space at the left midclavicular line. And after 1 minute of doing that, there are 150 beats per minute, so everything is normal. The abdomen is protuberated, but it's not distended. Movement is synchronous with respirations. And now I can go ahead and listen to the bowel sounds. So bowel sounds are heard in all 4 quadrants. And now I can go ahead and palpate the same quadrants. So there's no masses or tenderness, and I see the correct cord vessels, 2 arteries and 1 vein. The vein appears larger. There's no signs of bleeding, infection, no inflammation, redness, swelling. There's no purulent drainage, and there's no arrhythmia around the umbilicus. The extremities are symmetric, and they move through range of motion without hesitation. I would count the fingers on each hand and each foot, and I see that each has 5 fingers, 5 toes. There are 3 palmar creases on each hand. The extremities are all equal in length, and they're symmetric in the skin folds. Now I'm going to perform the Ortolani and Barlow maneuvers. So I'm going to go ahead and push the legs up and the knees up and rotate the hips out so it's smooth as it's supposed to be. There's no indication of hip dysplasia. And now I can go ahead and feel for the brachial and femoral pulses. So the femoral, brachial, and those are both present, strong, easily felt. And as I'm inspecting the extremities, I'll check the Babinski reflex by firmly stroking the sole of the baby's foot. And as I do this, the toe moved upward and the other toes fan out, and this is normal. I'll also check the palmar grasp reflex by lightly applying pressure with my finger to the baby's palm, and baby clenched my finger, so this is normal. These reflexes are also an indicator for gestational age. Now I can go ahead and check the genitalia, so I will go ahead and undo her diaper. So the genitalia is engorged, the urethral meatus is midline, the labia majora covers the labia minora, the clitoris is large, pseudomenstruation is present. This discharge requires no treatment. It's mucus mixed with blood for the first few weeks of life, so I'll go ahead and tell mom and dad about that. Now I'll go ahead and turn baby on her stomach. So I see that the spine is intact, there are no dimples or hair tuft, and the gluteal and leg creases are equal. There is lanugo on the shoulders and on the upper back, which is normal, and there are no Mongolian spots. Now I'll check the posterior breath sounds. In 6 locations again. So those are equal as well, same as the front. There's no problems there. And since the baby's now facing down, I'll check the Galen reflex by stroking down one side of the spine. And the baby laterally flexed toward the stimulated side. This is normal. And now I could go ahead and check the anus. So the meconium is passed, and so the anus is patent. Overall, I could turn the baby back around. So overall, her skin is smooth and intact and flexible. The color is consistent with her genetic background. And I'm checking now her skin turgor by pinching a small area of skin over her chest. So it returns to position immediately. So she's well hydrated, her skin is warm. There is acrocyanosis in the hands and feet. This is normal and intermittent in the first few weeks of life, and she has no cracking or peeling on her skin. Baby's condition is, her skin condition is an indicator of gestational age. The erythema toxicum or newborn rash is not present. Nexus flammeus or port white stain is not present. Nevus vasculosus or strawberry mark is not present. And so as I'm finishing up the assessment, I will wrap baby back up. Her diaper I'll put back on, and her blanket, and give her back to mom if I can. I'll clean my stethoscope, take off my gloves, perform hand hygiene, and then I'll document.